Question 1. A 65-year-old male presents for a routine colonoscopy screening due to a family history of colon cancer. The physician removes a single tubular adenoma discovered during the procedure. What CPT code should be reported? A. 45,378. B. 45,385. C. For 5378, 45,385 to 59. D. 45,385. Answer: D. For 5385. This question tests your understanding of CPT coding for colonoscopy procedures involving polyp removal during a screening. When a polyp or lesion is removed during a diagnostic or screening colonoscopy, you only report the code for the therapeutic procedure performed, which is the polyp removal. The code for the screening colonoscopy alone, for 5378, is bundled into the more comprehensive code for the removal, for 5385, when done during the same encounter. Always code to the furthest extent of the procedure performed during the encounter. Question 2. A patient is diagnosed with hypertensive heart disease with systolic heart failure. How should this condition be coded in ICD-10-CM? A. I-10, I-50.20. B. I-11.0, I-50.22. C. I-11.0, I-50.20. D. I-10, I-50.22. Answer: B. I-11.0, I-50.22. This scenario requires applying the specific ICD-10-CM guidelines for coding hypertensive heart disease. The alphabetic index directs you to code both the hypertensive condition and the heart failure. For hypertensive heart disease with heart failure, you should use a code from category I11-, and the fourth character indicates the type of heart failure. Systolic heart failure is classified with code I-50.22, and since it's due to hypertension, the correct combination is I-11.0 for hypertensive heart disease with heart failure, followed by I-50.22 to specify the type of heart failure. Remember that certain conditions, like hypertensive heart disease, have combination codes linking the etiology and manifestation. Question 3. A patient undergoes an MRI of the brain without contrast, followed by contrast, then followed by additional sequences without contrast during the same session. Which is the correct CPT coding? A. 70551, 70553. B. 70552. C. 70551, 70552. D. 70,553. Answer: D. 70553. This question tests your knowledge of radiology coding guidelines, specifically for sequential imaging studies with and without contrast. When an MRI study of the same body area is performed first without contrast and then with contrast, the CPT coding rules state you should report the single code that includes both the without and with contrast components. Code 70553 describes an MRI of the brain performed both without and with contrast. You do not report the without contrast code 70551 separately or in addition to the combined code. Think of it as the with contrast code often includes the without portion when performed together. Question 4. Which modifier should be used to indicate a significant, separately identifiable evaluation and management service performed on the same day as a minor surgical procedure by the same physician? A. -24. B. -25. C. -57. D. -59. Answer: B. -25. This scenario describes the need to report an E/M service distinct from a minor procedure performed on the same day by the same provider. Modifier 25 is specifically used to indicate that the E/M service was significant and separate from the procedure. Modifier 57 is for E/M services that resulted in the decision for major surgery. Modifier 24 is for unrelated E/M services during a postoperative period, and modifier 59 indicates distinct procedural services. Using modifier 25 tells the payer that the E/M visit wasn't just pre- or post-procedure work but a necessary, distinct service. Question 5. A patient is admitted to the hospital for acute respiratory failure due to an exacerbation of chronic obstructive pulmonary disease, COPD. What are the correct primary and secondary diagnoses in ICD-10-CM? A. J96.00, J44.1. B. J44.1, J96.00. C. J44.9, J96.00. D. J96.00, J44.9. Answer: A. J96.00, J44.1. This question tests the sequencing of diagnoses when a condition is due to an underlying chronic disease. Acute respiratory failure is considered the principal diagnosis here because it was the reason for the hospital admission. The alphabetic index under failure, respiratory, acute leads you to J96.00. The underlying cause, COPD with acute exacerbation, is then coded as a secondary diagnosis, which is J44.1. The guideline is to code the acute manifestation first when it's the reason for the encounter, followed by the underlying chronic condition. Question 6. A surgeon performs an excision of a benign lesion, 0.8 cm diameter, from the patient's arm, including a 0.2 cm margin on all sides. The resulting wound requires an intermediate repair of 3.5 cm. What CPT code should be reported? A. 11401, 12032. B. 11401. C. 11402, 12032 to 59. D. 11402. Answer: C. 11402, 12032 to 59. This scenario requires coding both the excision of a lesion and a separate wound repair. First, determine the size for the excision code by adding the lesion diameter and the margins, 0.8 cm plus 0.2 cm plus 0.2 cm equals 1.2 cm. For an excision of a benign lesion on the arm, you look in the 11400 series, and 1.2 cm falls into the 1.1 to 2.0 cm category, which is code 11402. Next, the repair is intermediate and 3.5 cm on the arm, which is code 12032. Since the repair of the excision site is considered integral to the excision unless it requires more than simple closure, an intermediate repair is separately reportable with modifier 59 to indicate it's a distinct procedural service beyond simple closure. Question 7. Which of the following terms means surgical removal of the appendix? A. Appendectomy. B. Appendicitis. C. Appendicostomy. D. Appendicular. Answer: A. Appendectomy. This question tests basic medical terminology by asking for the term related to the surgical removal of a specific organ. The suffix ectomy means surgical removal. Therefore, appendectomy is the correct term for the surgical removal of the appendix. Appendicitis refers to inflammation of the appendix. Appendicostomy is the creation of an opening into the appendix, and appendicular relates to the appendix or a limb. Knowing common suffixes like ectomy can help you decipher many medical terms. Question 8. A provider spends 40 minutes of total time on the date of the encounter counseling a new patient about managing their diabetes and adjusting their medication dosage. The documentation supports complex medical decision-making. What E/M code level is appropriate? A. 99,202. B. 99,203. C. 99,204. D. 99,205. Answer: C. 99204. This question tests your understanding of using time to select an E/M service level, particularly for new patients in 2021 and later guidelines. For office or other outpatient visits, time may be used to select the code level when 50% or more of the encounter time is spent on counseling and coordination of care, or as the sole basis for level selection, since 2021. A new patient visit level 4, 99204, requires a minimum time of 40 minutes spent by the physician or other qualified healthcare professional. Since the provider spent 40 minutes focusing on counseling and medication management, code 99204 is the appropriate choice based on time, assuming the documentation supports this. Question 9. According to ICD-10-CM guidelines, when a patient has both an acute and a chronic form of the same condition, and there isn't a combination code, how should they be sequenced? A. Code only the acute condition. B. Code only the chronic condition. C. Code the acute condition first, followed by the chronic condition. D. Code the chronic condition first, followed by the acute condition. Answer: C. Code the acute condition first, followed by the chronic condition. This guideline addresses the sequencing of acute and chronic conditions when separate codes exist for each. Unless otherwise specified in the alphabetic index or tabular list, when the same condition is described as both acute or subacute and chronic, and separate entries exist, the acute code is sequenced first. This sequencing rule is important because the acute phase is often the more severe or immediate problem being addressed during the encounter. Always check for combination codes first, but if none exist, follow the acute then chronic sequencing. Question 10. A patient presents with pain in the knee. The physician documents acute on chronic knee pain. What is the correct ICD-10-CM coding? A. Code only the chronic knee pain. B. Code only the acute knee pain. C. Code acute knee pain followed by chronic knee pain. D. Code chronic knee pain followed by acute knee pain. Answer: C. Code acute knee pain followed by chronic knee pain. This scenario is a direct application of the guideline regarding coding both acute and chronic forms of the same condition. When the documentation specifies acute on chronic, it means both conditions are present and contributing to the patient's symptoms. Following the guideline, unless a combination code exists, which it typically doesn't for general pain, you should code the acute condition first, followed by the chronic condition. This reflects that the acute exacerbation is the primary focus of the current encounter, while the chronic condition is the underlying issue. Question 11. What does the abbreviation PRN stand for in medical documentation? A. Prioritize reporting needs. B. As needed. C. Patient record number. D. Perform daily now. Answer: B. As needed. This question tests your understanding of common medical abbreviations used in documentation. PRN is a widely used abbreviation originating from the Latin phrase pro re nata, which translates to as needed. You will frequently see this abbreviation in medication orders or treatment plans indicating that a treatment or medication should only be administered when the patient requires it based on their symptoms or condition. Knowing common abbreviations is essential for accurately interpreting medical records. Question 12. A pathologist examines a biopsy of a skin lesion. The report describes the gross and microscopic examination of the tissue. What type of CPT code category would these services fall under? A. Surgery. B. Radiology. C. Pathology and Laboratory. D. Medicine. Answer: C. Pathology and Laboratory. This question relates to the CPT codebook sections and where services for tissue examination are located. The examination of tissues, like biopsies, falls under the scope of pathology services. The CPT codebook has a dedicated section for pathology and laboratory procedures, which includes codes for surgical pathology that describe the gross and microscopic examination of specimens. This section is distinct from surgery, procedures, radiology, imaging, and medicine, non-surgical treatments and evaluations. Question 13. A patient is seen for follow-up of hypertension and stable angina pectoris. The physician reviews medications, checks blood pressure, and discusses lifestyle modifications. This visit is solely focused on managing these two chronic conditions. How should the diagnosis codes be sequenced in ICD-10-CM? A. Sequence either hypertension or angina pectoris first. The order does not matter. B. Sequence hypertension first, then angina pectoris. C. Sequence angina pectoris first, then hypertension. D. Sequence the condition the physician spent the most time addressing first. Answer: A. Sequence either hypertension or angina pectoris first. The order does not matter. This scenario involves managing two chronic conditions that are not specified as linked by a due to or with relationship in the documentation. When two or more diagnoses meet the criteria for principal diagnosis, in an inpatient setting, or are equally contributing to the outpatient visit, as here, and neither is clearly designated as the main reason, either condition can be sequenced first. There is no rule dictating a specific order based on which condition is hypertension or angina, or based on time spent, unless the documentation clearly specifies one as the primary focus for this encounter. Question 14. According to CPT guidelines, what is the global surgical package period for a minor procedure? A. 0 days. B. 10 days. C. 30 days. D. 90 days. Answer: B. 10 days. This question tests your understanding of the global surgical package concept in CPT. The global surgical package includes all necessary services normally furnished by a surgeon before, during, and after the procedure. Minor procedures, identified by a 10-day or 0-day postoperative period indicator in the Medicare fee schedule database, typically have a global period of 10 days. Major procedures usually have a 90-day global period. Knowing the global period helps determine when follow-up visits are included in the procedure code payment versus when they can be billed separately. Question 15. A patient receives an injection of Kenalog into the left knee for osteoarthritis. What is the correct HCPCS Level II code for the Kenalog medication? A. J3300. B. J3301. C. J3302. D. J3303. Answer: A. J3300. This question requires knowledge of HCPCS Level II codes used to report injectable medications. HCPCS Level II codes, specifically J codes, are used for drugs administered parenterally, by injection. You would look up Kenalog or the generic name triamcinolone acetonide in the HCPCS index to find the appropriate J code. J3300 represents 10 mg of triamcinolone acetonide. When reporting, you would code the number of units administered, e.g., for units for a 40 mg dose, along with the administration code, e.g., CPT code 20610 for a large joint injection. Question 16. Which anatomical term refers to the back of the body? A. Anterior. B. Posterior. C. Superior. D. Inferior. Answer B. Posterior. This question tests basic anatomical directional terms. Posterior refers to the back of the body or situated toward the back. Anterior refers to the front, superior means towards the head or upper part, and inferior means away from the head or lower part. Understanding these terms is fundamental for accurately interpreting anatomical descriptions in medical documentation and selecting correct codes. Question 17. A patient presents to the emergency department with chest pain. After evaluation, the final diagnosis is non-ST elevation myocardial infarction, STEMI. How is the STEMI coded in ICD-10-CM? A. I-21.4. B. I-21.0. C. I-21.3. D. I-21.A1. Answer D. I-21.A1. This question tests your ability to find and apply the specific ICD-10-CM code for STEMI. Myocardial infarction codes are found in category I-21-. STEMI has a specific code, I-21.A1, which represents STEMI, non-ST elevation myocardial infarction, type 1. The codes I-21.0, I-21.1, I-21.2, and I-21.3 are for ST elevation myocardial infarctions, STEMI, in different locations. It is crucial to distinguish between STEMI and STEMI for accurate coding. Question 18. A patient is seen for a scheduled follow-up visit regarding chronic asthma. During the visit, the patient mentions a new onset of symptoms suggestive of strep throat. The physician performs a problem-focused history and exam related to the strep throat symptoms and orders a rapid strep test, in addition to managing the asthma. What modifier might be appropriate if the strep throat evaluation is significant and separate? A. -24. B. -25. C. -57. D. -59. Answer B. -25. This scenario describes an encounter where a patient is seen for a scheduled chronic problem, but a new, separate problem is also evaluated during the same visit. Modifier 25 is used with the E/M code to indicate that the E/M service was significant and separately identifiable from the other services performed, in this case, the management of the chronic condition and potentially the strep test interpretation if billed separately. The E/M portion of the visit addressed two distinct issues, and the work involved in evaluating the new strep symptoms was separate from the routine asthma follow-up. Question 19. A patient had surgery 2 weeks ago. The patient returns to the operating room for a complication that is related to the original surgery. What CPT modifier should be appended to the surgical procedure code for the complication? A. -78. B. -79. C. -58. D. -59. Answer A. -78. This question tests modifier usage within the global surgical period. Modifier 78 is used for an unplanned return to the operating room for a related procedure during the postoperative period. This indicates that the reason for the return was a complication of the original surgery. Modifier 79 is for an unrelated procedure during the postoperative period. Modifier 58 is for a staged or related procedure during the postoperative period, planned or anticipated, and modifier 59 indicates distinct procedural services. An unplanned return due to a complication points specifically to modifier 78. Question 20. A patient is diagnosed with sepsis due to methicillin-resistant Staphylococcus aureus, MRSA. How should this be coded in ICD-10-CM? A. A41.02. B. R65.20, A41.02. C. A41.02, B95.62. D. A41.9, B95.62. Answer, C, A 41.02, B 95.62. This question involves coding sepsis with a specific bacterial etiology. Sepsis due to a bacterial infection is coded first, followed by the code for the specific bacteria. Code A41.02 is for sepsis due to MRSA. Additionally, you need to report the code for the infectious agent, MRSA, which is B95.62. The guideline for coding sepsis states to code the systemic infection first, and then identify the infectious agent if known. Remember to always follow the instructional notes in the tabular list, which often indicate the need for an additional code to identify the infectious agent. Question 21. The structure responsible for filtering waste products from the blood to produce urine is the A. Lung, B. Liver, C. Kidney, D. Heart. Answer, C. Kidney. This is a basic anatomy question testing knowledge of organ function. The kidneys are the primary organs of the urinary system responsible for filtering blood, removing waste products and excess fluid, and producing urine. The lungs are involved in respiration, the liver has many metabolic functions including detoxification, and the heart pumps blood. Understanding the basic function of major organs is important for understanding medical conditions and procedures. Question 22. What is the primary purpose of HCPCS Level II codes? A. To describe physician services and procedures. B. To report durable medical equipment, prosthetics, orthotics, and supplies. C. To classify diseases, injuries, and causes of death. D. To describe hospital inpatient services. Answer, B. To report durable medical equipment, prosthetics, orthotics, and supplies. This question clarifies the purpose of HCPCS Level II codes within the coding system. While CPT, HCPCS Level I, primarily describes physician services and procedures, HCPCS Level II codes are used to report a wide range of other healthcare products, supplies, and services not covered by CPT. This includes items like wheelchairs, crutches, specific drugs, ambulance services, and certain provider services. ICD-10-CM is used for diagnoses, and hospital inpatient services often use ICD-10-PCS for procedures. Question 23. A patient is admitted to the hospital with pneumonia. The physician documents pneumonia due to Streptococcus pneumoniae. What is the correct ICD-10-CM code for this condition? A. J18.9, B. J13, C. J18.0, D. A40.3. Answer, B. J13. This question tests your ability to code pneumonia when the specific bacterial cause is documented. The ICD-10-CM tabular list provides specific codes for pneumonia due to various infectious agents. Code J13 is specifically for pneumonia due to Streptococcus pneumoniae. Code J18.9 is for unspecified pneumonia, J18.0 is for bronchopneumonia, unspecified organism, and A40.3 is for sepsis due to Streptococcus pneumoniae. Always look for codes that specify the organism when it is documented, as this provides greater specificity. Question 24. In medical billing, what is the purpose of an Advance Beneficiary Notice of Non-Coverage, ABN? A. To inform the patient that a service is medically necessary. B. To notify the patient that Medicare may not pay for a service. C. To authorize a referral to a specialist. D. To document the patient's allergies. Answer, B. To notify the patient that Medicare may not pay for a service. This question relates to billing practices and the use of specific forms like the ABN. An ABN is a written notice given to beneficiaries by providers before rendering a service that the provider believes Medicare may not consider medically reasonable and necessary. It informs the patient that they may be responsible for payment if Medicare denies the claim and requires the patient's signature. Its primary purpose is to shift potential financial responsibility from the provider to the patient. Question 25. A patient is seen for a follow-up on a fracture of the distal radius that is currently healing normally. What is the appropriate status code in ICD-10-CM? A. Initial encounter for closed fracture. B. Subsequent encounter for fracture with routine healing. C. Subsequent encounter for fracture with delayed healing. D. Sequela of fracture. Answer: B. Subsequent encounter for fracture with routine healing. This question tests the use of episode of care codes for fractures in ICD-10-CM. Fracture codes include a seventh character that indicates the episode of care. An initial encounter, A, B, C, is used while the patient is receiving active treatment for the fracture. A subsequent encounter, D, E, F, G, H, J, K, M, N, P, Q, R, S, is used for encounters after active treatment has begun but the fracture is still being managed. Since the fracture is healing normally and the patient is in a follow-up phase, the correct status is subsequent encounter for fracture with routine healing, typically represented by the seventh character D.